Hello, it's Susan Moore for Spirit of Women and Banner Health. We Spirit Women are always interested in knowing better ways of taking care of ourselves, but probably more important, better ways of taking care of our loved ones. And boy, the subject of orthopedics covers a broad spectrum, and I'm just delighted that Dr. Steve Sides is here today. And Steve, orthopedics. What don't you do? No, let's start with what do you do? What parts of the body do you take care of?
Well, we take care of really the entire musculoskeletal system. So if you think of anything that has to do with bones and joints and muscle and tendons, that's kind of our field. So that covers just about everything that's not in your chest and abdomen and your brain pretty much. So anything else that has to do with being a moving, breathing animal, we tend to take care of those problems.
All right, speaking of moving, breathing animals, the weekend warrior, do you see more people on the weekends, or does it never end?
I'd probably say it never ends, but there's certainly times of the year when the weekend warriors are dominating our practice. So,
tell us some of the things they do to hurt themselves.
Okay, well, let's see. Everything from the softball player that hasn't warmed up very well, that ruptures his Achilles tendon because he's not very loose and has to sprint after a ball. We see people like that. We'll see somebody that's been overusing their arm, throwing too much when they haven't been throwing for 3 years, and they decide to start playing a sport again, and they'll tear their rotator cuff or injure their labrum. We see people like that. And then there's always, bicycling accidents, motorcycle accidents, which I consider all part of the activities of the weekend for people.
Sure, absolutely. Now, you're moving in my direction. Now, this has really been growing in this part of this part of northern Colorado,
Right.
but you're actually really well beyond west of the interstate.
Correct. We, in the last year, have taken on a Loveland office and then most recently a Fort Collins office too. So we're trying to move west, and I think we're successfully doing that. So.
Yeah, well, we're excited to have you in Fort Collins. Are you going to be at
Well,
the new
thanks.
Banner Health building?
Right, we'll be at that new Banner Health Fort Collins building, as well as McKee, where we've been practicing for a while.
Very good, because that's right up the road from me. It's all about me and being convenient for me. When does somebody typically, obviously when you're injured like that, but do you also get patients that come to see you that haven't been injured, but they're just not feeling well? What is your typical patient?
Sure. So, we see everything from arthritis to carpal tunnel syndrome, things like that. So often people come to us because they think they have a hand problem or a wrist problem, and sometimes it ends up being a neurologic problem. But nevertheless, we still see a lot of those people to help examine them and figure out really what the issue is. So if somebody has a neck problem, sometimes it manifests itself as a shoulder condition. And so they come and tell us they have shoulder pain, and it turns out they really have a neck issue like a herniated disc or something like that. So then also people come in sometimes with unusual complaints about joints aching, and sometimes we make the diagnosis of rheumatoid arthritis or something like that, and then help them get back to the right place to see a medical doctor as well.
Okay.
So.
And what's the difference between a sprain and a strain?
Oh, tricky.
Is it?
That is kind of tricky. I don't think anybody can tell you exactly the difference, actually.
Oh, really?
And if you look at the coding books and what the insurance companies think of, there's a lot of overlap in those two conditions. So I think of them as similar, and we don't often use the term strain much anymore. We usually stick to sprains.
Sprain,
Yeah.
and that's what? Everything?
So sprain is usually related to a tendon or a muscle group that has been injured. So if you take a tendon, for instance, or a ligament, you could say that if you partially injure that, that's a sprain. So anything that causes a little bit of a pain in that area, we'd still consider that a sprain. And then there's varying degrees of that depending upon the extent of the injury.
All right. And so what if it happens to be a broken bone in there too? Can it still be a sprain?
You can have a sprain that coexists with the fracture as well, sure. So if you have a broken bone, there's certainly a lot of other areas that can be injured. We sometimes think of a broken bone as an injury where the soft tissue failed and then the bone broke as well. So you can tear a ligament and break a bone at the same time. We see that a lot in ankle fractures and wrist fractures as well.
Did you have a lot this winter when there was so much ice and snow?
It does pick up a little bit when it's icy and snowy for us too.
Yeah.
We used to think that our summertime was our worst month, but if you live in this part of the world, when we get these quick ice storms, people are rushing to get to the grocery store and getting home, and then they end up wishing they hadn't done that little trip.
Yeah.
So we get a lot of that, yes.
And just for kicks, because of all your spare time, I'm sure,
Mm-hmm.
you also take care of the athletes at UNC.
Correct.
How fun
Correct.
is that?
Yeah, that's really fun. That's probably the funnest thing that that I do in my job is take care of those kids.
Uh-huh.
They're a motivated group. They get injured, but they want to get back to what they're doing, and so they're usually a pretty captive audience to get healthy and get back on the right way. We have a really good staff of physicians that are working with that group, all in our group of orthopedic surgeons, and then we also work with the athletic training department there very closely to kind of get those kids back on the field and get them playing again.
Nice. What would you like to share with all of us today that I haven't asked you about? Something that you'd like us to take away?
Well, I just think, one of the things I'd say is probably our group has grown quite a bit recently.
Mm-hmm.
We've added 3 new doctors and about to add a 4th. So we've grown quite a bit, and that's helped us to expand, obviously. But we're really a unique group. Everyone in our group has that area of specialty that is
Like the
kind of an
hands?
additional function. So, all orthopedic surgeons will see a lot of different parts of the body, but everybody has an area of interest, and we have almost everybody in the group is fellowship trained. So we have hand surgeons, we have a trauma surgeon, we have foot and ankle and sports covered very well. We have a shoulder guy. So we kind of really cover all parts of the body very well with just our group, because I think we're uniquely qualified because we have so many guys that are trained in so many different specialty areas, or subspecialty areas, as we say.
Nice. Thank you so much. I know you're busy, and I appreciate you taking a minute here to stop by, because I am Susan Moore for Spirit of Women and Banner Health.